Doctor, you've been practicing sleep medicines for over 30 years. From your experience, what's the biggest mistake people make when it comes to sleep?
Namaste. See, in my sleep practice for more than 3 decades, one thing has remained constant. That is, most patients come to us for too late. Sleep is usually the first thing people compromise and the last thing they prioritize. In the sense, they are not giving much importance to the sleep. So, sleep in general is a vital, metabolic, essential function of the body. Sleep is one of the pillars of health, like diet, exercise. Sleep is in paramount important. But in our people, they give a very last priority to the sleep. They think sleep is not at all essential thing. It's a luxurious and all their thinking terms. But sleep is a real life science necessity for our real function, good healthy system in our body. So all because of the lack of awareness.
Yeah.
So people usually came to us with a very last stage, in the sense all the disease because of the sleep apnea, sleep deprivation, insomnia. With the end stage only patient come to us for the treatment purpose because of the lack of awareness about the sleep and sleep health.
So they've been struggling since a long time, but at the last moment when it actually starts severely affecting them, that is when they come and see doctors.
Exactly.
But I think this is something that we have been noticing as well when we were doing market research. And what we have realized when we did user research is people actually don't ignore sleep intentionally. It just gets sidelined. But from a clinical perspective, why do you think something like this happens, or what do you think is actually broken in a traditional sleep care system?
Yeah. See, traditionally, the sleep care has been fragmented. So patients move from symptoms to tests and reports, but rarely receive the continuous treatment. So sleep is a regular daily habit. So we have to follow the regular sleep schedule, sleep timing, and other sleep schedule we have to follow regularly. This is a continuous long-term sleep habits. Sleep hygiene is a sleep, one of the important long-term daily basis we have to take care of the sleep. So, but in our population, because of the lack of awareness to the sleep health and the sleep thing, but patients suffering from without much importance. That's the reason all leads to the sleep issues because of lack of awareness.
Understood. So this gap is exactly what led us to build Sleep Alpha. So from what you have seen so far in the past 30 years, what excites you most about this approach of integrative and connected sleep care system that we are building at Sleep Alpha? What is the most prominent thing that you see, and how do you think this will impact the sleep care delivery?
Yeah, what excites me about Sleep Alpha is that so directly addresses this gap. So a lot of gap is there. We have to fill the gap. So Sleep Alpha is a pioneering to fill all the gaps, defect, etc. It brings together technology, clinical expertise, and the sleep coaching into a truly integrated and connected care. So care model. This is one of the important system. So technology helps to identify early. Coaches help patients translate the data into daily habits. And clinician, clinical, and as an expert, we expert step into the right time and not as a last resort. So this is the role. Sleep Alpha is playing a major role to fill that gap.
Got it. So what you mean to say is it's not just about diagnosis, and it's not just about doctor consultations. It is about the awareness, and more importantly, after creating an awareness, it is about the continuous monitoring and the continuous care delivery system that is important. So
exactly.
That continuum has to be maintained when it comes to sleep care delivery.
Yeah, exactly. So this is how the Sleep Alpha should be delivered today. So not episodic, but continuous. Not reactive, but preventive. And always patient-centered. So when sleep is cared for properly, everything else improves, like physical health, mental well-being, and overall quality of life will improve. So sleep well, live better is the concept behind. So we will take care of the sleep. Yes.
Got it. Thank you, doctor. I think that's a powerful insight. Any thoughts on where sleep care needs to go further, like from 2026 onwards? Where do you think should the sleep care delivery go towards, and what do you think is the future of sleep care?
Yeah.
And how does Sleep Alpha play a prominent role there?
Sleep Alpha represents an important step forward in making quality sleep accessible and structured and sustainable one. If we want a healthier individual and a healthier societies, we must start by taking sleep seriously. Sleep is not a luxurious thing. We have to take care of seriously. So if we take care of sleep well, sleep care, so definitely our system, our productivity, everything improves. We don't face unnecessary morbidity and mortality. We can have a good quality, happy life.
Thank you, doctor. Thanks a lot.
Thank you, Jasmine.